In today's video, I, a birth doula, will be answering your commonly asked pregnancy, childbirth, and postpartum questions. I want to first preface this video with the fact that I am not a medical professional. You will notice me say that you should have a conversation with your doctor or care provider numerous times throughout this video. My goal as a birth doula is to facilitate conversation and education. So it is my goal that by you watching this video, you will learn that you can communicate with your doctor. You can find correct information through the resources that I put in the description down below, and you can have conversations as well and educate and empower yourself. So let's get started with this video. Hey guys, and welcome back to my channel. If you are new here, my name is Victoria and I run Time and Tenderness here on YouTube and on Instagram. I post a lot of homemaking, lifestyle, cooking, and cleaning videos. But if you have been following me for a while, you will know that I am also a birth doula, and I will occasionally post a pregnancy, childbirth, and postpartum informational video here on my channel. It's been a while since I have done that, so let's get started with this Q&A video. So the first question I get a lot is, what is a birth doula? Now, a birth doula is a trained professional who supports families both informationally, emotionally, and physically during the pregnancy and childbirth process. So I am trained in various comfort measure techniques to help families get through labor, whether they're choosing to have an epidural, an elective C-section, or go all natural. I am trained in all of those aspects and areas and how to support a family. I also help facilitate communication between a family and their care provider and ask very basic questions. So I am not a medical professional. I am just a support person that helps people get educated. So our second question that we have come to is, what is a midwife? Is a midwife the same thing as a doula? And no, it is not. A midwife is a medical professional. Chances are they've also been to nursing school, they're an RN, or they are a professional midwife in which they took a separate type of training course, but they are a medical professional, strictly being educated in the medicine side of childbirth, pregnancy, delivery, and the postpartum period. You can also go to a midwife for your well woman exams, for fertility consultations, all that stuff. So they are a medical provider when it comes to pregnancy and childbirth. So the next question, number 3, the third question that I got was, will my baby be born on my due date? And in a nutshell, chances are no, your baby will not be born on their due date. I did an informational post on my Instagram page, so if you're not following me there, that'll be in my story highlights for all that information. But no, chances are your baby will not be born on your due date. I am so sorry to be the bearer of bad news if you are hoping and praying for that day to happen. But no, only 5% of babies are born on their due date, and a typical healthy pregnancy can last anywhere between 37 weeks gestation to 42 weeks gestation. So technically you have a due month. So you can say, my baby is going to be born sometime in April or sometime in May, or whatever month that your due date, your estimated due date is. You can say that broad term, but chances are you only have a 5% chance of your baby being born on that actual day. Now that I answered that question, I'm just going to do a little sidestepping here, because I get that question a lot, is, will my baby be born on my due date? And I see a trend rising on social media of all this emphasis on due dates. And as a birth professional, as a doula, knowing what I know about due dates, I think that all of this, and it's just my personal opinion, don't hold me to it or anything, it's not fact or anything, but it's just my personal opinion that all this emphasis on the due date can actually be more harmful than good. I'm just gonna give you a general example. I saw this about 2-3 years ago on social media. There was a very large Instagram influencer. She was having her first baby. She was doing this huge countdown for when baby was gonna come. She was posting every day a countdown. She was doing weekly updates, all of which is fine and great. But she was one of those influencers who also overshared. She did a lot of live streams and kind of overshared, which is a whole nother topic that, you know, I could get into about oversharing on social media, but she overshared. She live streamed her ultrasound, she live streamed the gender reveal, she live streamed a lot of things and posted her whole life out there. And she was asking for advice and pregnancy advice from her followers instead of going to her doctor. She even said at one time, you know, on a live stream, she was like, oh, I know I could ask my doctor this, but I don't feel like calling them, so why don't I just ask you guys? That can be kind of dangerous, not asking a medical professional medical advice. You really should check with your doctor and your care provider about a lot of things, but enough about that. Going back to due dates. This Instagram influencer, her due date came and her due date went, and baby did not come. And she started live streaming and posting on Instagram how disappointed she was that the baby was not coming, that she was nowhere near exhibiting any signs of labor, that this was a problem because now the baby risked coming on a date that she didn't want the baby to come on. So if you are someone who's educated in birth and knows anything about birth, you can sense my frustration and, you know, why that was very upsetting. And upsetting too because she's a very large influencer who has a huge following, and she's, you know, saying the message that the due date was extremely important, that the baby had to come, that there was something wrong, that the baby did not come on the due date. And like I mentioned before in answering the question, you only have a 5% chance of your baby coming on their due date. And like I said, a healthy pregnancy can last anywhere between 37 and 42 weeks with the supervision of your care provider. Your care provider will let you know if it's unhealthy to go any further or if baby needs to come right away. So this influencer, she, you know, was very upset that baby didn't come on that certain day. And then she went ahead and, you know, told all of her followers that she was going to have an elective induction. Her doctor said she could induce if she wanted to, but she didn't need to. She said that in a video. You can induce if you want to, but you don't need to, you know, it's normal. Like, she admitted that her doctor told her it was normal for the baby to, you know, not be born yet, but she went ahead with an induction anyway. Unfortunately for this influencer, and my heart goes out to her because, you know, of her experience that she had, and I really wish she had the education and support system of a doula, of, you know, having a better communication with her doctor, her care provider, because all of this could have been prevented. And ultimately she had a failed induction and then had to have a C-section, and she ended up having a lot of trauma after that she of course shared and overshared on social media. Ended up having postpartum anxiety and depression, which now she is a huge advocate for, so that is great because we need more advocates for postpartum anxiety and depression and all of that with postpartum and how difficult it can be for some women. So she is a great champion for that now, but 2 years ago when this was going down, when she was oversharing and she was putting all this emphasis on her due date and then having a failed induction because she had the induction purely because she didn't want the baby to be born on a certain day as something else. I think it was like a holiday or an anniversary or something. She didn't want the baby to share a birthday with that particular date, which chances are if she had just let her pregnancy go normally, she probably would have, that additional day would have come and gone too, and baby would have been born nice and healthy. You know, you really can't tell, and who am I to say as well, because I'm just a viewer on social media. But after I saw that kind of really started to spur up in me wanting to share more correct information online with you all and with all my followers and subscribers, because there's a lot of incorrect information out there, and unfortunately there are a lot of uneducated people out there who, they mean well, they really do, and they're trying to, you know, navigate pregnancy and postpartum, but unknowingly they might be sharing some false information. So that kind of instance, if it makes any sense at all to you all listening to me ramble on right now, is kind of what spurred me on to want to make this video and answer some basic Q&A questions, because, you know, especially with due dates, I still see a lot of people doing a countdown to when baby is born. their due date will come and go and they'll be very upset and they'll be, you know, complaining, or they're complaining like, why is everybody messaging me asking me if baby's here? Well, because everybody knows your due date and they're expecting, and society for some reason, they have put so much emphasis on that one day that, oh, baby is due April 12th or whatever day it is. There's only a 5% chance of your baby being born on that specific day. Just listen to your care provider, make sure everything is going healthy, you know, talk with your care provider, and know in the back of your mind that chances are a baby is not going to be born on that day. Especially if you're a first-time mom, your chances of going past your due date are a whole lot more likely than you going early or on your due date. So that brings us to our fourth question. My friend said she was in labor for a week. Is that normal? So, for a first-time mom, the average length of labor is 24 to 48 hours. For a woman who has had subsequent pregnancies, it can be shorter than that. But labor for a week, you might want to ask some questions like, okay, you say you were in labor for a week. So when I talk to a client or a friend who says, oh, I was in labor for a week, chances are they weren't actually in labor for a week. They were just uncomfortable for a week. Now, this isn't to negate or poo-poo on anybody's feelings or what they were actually going through, but when you're actually getting into what labor is, active labor is when you are actively dilating and you have consistent contractions. You can be having contractions on and off and pattern contractions on and off for weeks or months leading up until pregnancy, in late pregnancy, but that technically is not labor. That's just your body gearing up. Those are the false alarms that people get tripped up over sometimes when they go to the hospital too early. But when somebody says, I was in labor for a week, I would take that with a grain of salt and know that, and probably, you know, keep in the back of your mind that there was probably something else going on at the same time. Maybe they were, you know, just having all those false alarms, the Braxton Hicks for a week, stuff like that. You know, dehydration. If you're dehydrated, you can get contractions as well, which is why it's really important to stay hydrated late in pregnancy. Baby could not be positioned correctly in the uterus, and the uterus is like, get over there, and doing that kind of thing. So there's a lot of other underlying causes as to why somebody might say, I was in labor for a week. Chances are they weren't actually in active labor for a week. They might have just been uncomfortable for a week. The fifth question that I have received lately is that, are home births safe? So a home birth is when you choose to give birth at home, attended to by a midwife. Yes, they are safe, provided that you have been cleared by your midwife and your doctor that you are having a low risk normal pregnancy. So that is something that you should have a conversation with your medical team or your local home birth midwife to see if you are a candidate for a home birth. What is a birth center? So that is the next question. What is a birth center? Now, a birth center is not the same as your labor and delivery floor at your local hospital. I know a lot of hospitals, especially the one near me, they call their labor and delivery a birth center. They are not the same. So a birth center is a standalone facility that has, you know, more amenities in line with being at home or a hotel than at a, you know, typical labor and delivery floor. A birth center is typically run by midwives. You have more of a family-friendly setting in that you have a suite. Chances are you have a tub, a shower, a king-size bed, not a hospital bed. You have a normal bed, and then after a baby is born, you get to go home an hour, 2 to 4 hours typically after baby is born. You don't have to stay the night. So it is separate from a labor and delivery floor, but a birth center still also has a lot of medical equipment in the event of an emergency arising. So if you want to have a more natural style birth, but you're afraid to do it at home for various reasons, but you don't want to go to the hospital and be subject to all those interventions and hospital policy, a birth center is a happy medium between the two. So question number 7, is there ever a reason to have an epidural? The only reason you should have an epidural is if you want one. Now, if you want one, go ahead and have an epidural. There's nothing wrong with wanting to have an epidural, and there's nothing wrong with wanting to go it all naturally. always talk with your doctor and learn about the pros and cons of the epidural, of the medicine, if you're a good candidate for it, and find out if that is a choice for you. But the only reason you should ever have to have an epidural is if you want one. Of course, there are other situations that might arise where you are medically necessary. It is necessary to have an epidural, but always that is something that you should do your research on, and I will link any resources that I think might be helpful to families down in the description down below. Question number 8. My friend told me that only formula-fed babies sleep at night. I really would like to breastfeed. Is that true? No. So there's a very sensitive argument between formula versus breast milk, or fed is best, or breast is best. Going down to a scientific standpoint, formula is no substitution for breast milk. Breast milk is for babies. We are naturally supposed to feed it to babies. It is for babies, but there are instances where formula is necessary. Sometimes mom is just not able to make milk. There are other underlying difficulties, so that is where formula comes in, and formula does save lives every year. But those when I see something like my friend told me only formula fed babies sleep at night, I think of, you know, there's old wives' tales, but then there's something I like to call street tales, which are, you know, just little fables that people tell that, you know, aren't true. Like old wives' tales, there's some truth in some old wives' tales, but in some street tales, there's not that much truth in them. And you know, this goes back to, there used to be a time where a lot of formula companies pushed the agenda that formula was best, that your kid will be smarter if you just fed them formula, and all of which was false. So, you know, a lot of the myths that went around for a long period of time was that formula fed babies sleep at night. It is normal for your newborn to feed every 1 to 2 hours. They need, when they wake up and they need to eat, they need to eat. It is normal for a baby to be waking up that many times. If you want to get more information, you can contact, sorry, I'm like not speaking correctly now. You can contact your local La Leche League, which I will leave in the description down below. They are a breastfeeding support group, but they also, you know, give you tons of information about how to help keep your baby safe and feed them well. You can also reach out to a local lactation consultant who will give you correct and up-to-date information about how to feed your baby. So question number 9 that I have received: do I have to take all the tests and scans and appointments my doctor suggests? Now, this is a question that I'll get, and of course I don't want to contradict a doctor. A doctor knows way more than I do. They went to school, they are the medical provider, so I don't know what's going on that end. But there are a lot of tests and suggestions that a doctor might make that might not always necessarily be necessary. Sometimes the doctor will just run all these routine tests just to be on the safe side, but it might not be completely necessary. So when you're, you know, faced with an appointment or a test that your doctor is suggesting that you have, you might want to sit down with your doctor and really ask the deeper questions. Why are we having this done? Am I at risk for something? Is my family history the reason why you want me to have this? Or, you know, get into the deeper facts of why is my doctor wanting to have this done. Some doctors will just run all the tests that they can, just in case they want to catch something. But not everybody needs to have all of those tests done. You can have that conversation with your doctor and really press and, you know, ask those hard questions like, why do you really want me to have this done? Is it really necessary? What happens if I don't have it done? You know, etc., etc. Okay, so question number 10. My birth center, let me start over. Question number 10. My birth center requires all patients to take a childbirth class if they intend to give birth at the center. My friend told me childbirth classes are a waste of money. Why would a birth center require this? Now, I did do a video all about why you should take a childbirth class. I highly recommend that any and all expectant families take a childbirth class. But from experience, I know that birth centers, they want you to be as educated as possible. Birth center really takes a stance on education. It means empowerment. So they want you to be as prepared as possible, because a birth center is not going to have all of the, you know, hands-on deck facilities that a labor and delivery floor will have. When you are working with a birth center, your chances are you're only working with a midwife and a midwife's assistant at the center. So it's just you, your partner, and your doula, if you even have a doula, and then 2 medical providers there. So there's not a lot of people in the room. So you really need to be educated on comfort measure techniques. Also, another thing too, at a birth center, you don't get an epidural. You might not get any pain medication or augmentation of that sort. So, sorry, somebody is thirsty over here. We'll wait for Layla to finish. Are you done? Thank you. So, where was I? So a birth center will want you to take a childbirth education class so that you are most prepared to what to expect when it comes to your labor, because laboring all naturally without all the medical instruments is very different, and you don't have as much of a support team. You have a support team at a birth center, but you're not gonna have the dozens and dozens of nurses that are there, you know, food and all that stuff, and you get sent home right away after the baby is born. You don't spend the night at a birth center. So yes, there might be various reasons why a birth center wants you to take a childbirth education class prior to you giving birth there, and it's because they want you to be as prepared and informed as possible. The next question that I got a lot was, what are those eye drops that they put in the baby's eyes after they're born? Okay, a bird just hit the window. So the eye drops that they put in babies' eyes, this is an antibiotic. It is to prevent syphilis and gonorrhea mainly. There's also other pathogens that it helps prevent against when baby is born. But that is a conversation you should have with your care provider, with your midwife, your doctor, whoever you're seeing as your care provider, as to if you really need those eye drops. If you are clean, if you don't have any STDs, STIs, nothing like that, then those eye drops aren't always that necessary. So that's a conversation that you should have with your midwife, your doctor, your care provider, whoever you're seeing, as to if you really actually need to have those eye drops put into your baby. The next question that I received is, if my water breaks, do I have to call 911? No, you do not have to call 911 unless if your water breaks, you notice a significant amount of blood, discoloration, odor. If you just have this gut feeling something is wrong, then of course, call 911. Listen to what your care provider had previously told you as well. If in the event that your water breaks at home, if you are preterm, of course, call 911. But if you are, expecting your baby, your hospital bags are packed, you're ready to go, you're like watching on the clock, is labor gonna start? Is labor gonna start? And your water breaks, no, that's all the normal processes of labor. If your water does break and contractions haven't started yet, go ahead and call your care provider and see what their protocol is. Some care providers will allow you to stay home for up to 12 hours to see if labor starts on their own. Other care providers feel more comfortable with you coming in right away just to check things out. So that's something that you should clear with your care provider, but chances are you do not need to freak out and start screaming and call 911 if your water breaks when you're already full term. Next question. When is a good time to go to the hospital or birth center when labor starts? So I get this question a lot as a doula, because also families want to know when to call me, when do they need me. So there is a rule called the 5-1-1 rule. So that is when your contractions are 5 minutes apart, lasting for 1 minute, and they have been consistent for 1 hour. So that rule means chances are that you are nearing or you are in active labor. You also want those contractions to be very intense. Now, I have had clients in the past reach that 5-1-1 rule, but they're still walking around, going grocery shopping, talking to me on the phone. The contractions are very mild, like almost like period cramps. So that is an active labor. You might not want to go to the hospital just yet, but if you notice an increase in the severity of the pain at such, it's building, the pain is building, then yes, you might want to head over to the hospital, the birth center, or just give your care provider a call and see what they say. The next question that I got are, what resources are out there to support women who want to breastfeed? I will link these resources down below, but I already mentioned some in the video previously. That is La Leche League, which is a nonprofit or just an international organization that helps support women with breastfeeding, as well as local lactation consultants. And a local lactation consultant, you can check with your local doctor's office, your local hospital that you had the baby at, or the birth center. Chances are they have one on staff ready to meet with you. Next question. When should I stop drinking alcohol? As soon as you find out you're pregnant. So yes, if you take a pregnancy test, you find out it's positive, no more beer, wine, alcohol, none of that. But don't freak out if you take your pregnancy test and the Saturday before you went out for drinks with your girlfriends. Don't freak out. I mean, think about all of human history, and it isn't until recently that people realize that alcohol was dangerous to the developing baby. We've gotten this far, so you drinking one time in early pregnancy without you knowing that you were pregnant is probably going to be okay. Of course, bring it up at your first doctor's visit, let them know. But as soon as you find out you're pregnant, stop drinking. If you really want to be on the safe side and you are actively trying to get pregnant, some people do stop drinking altogether just because they don't want to risk anything at all. But as soon as you find out you're pregnant, no more drinking. When should I start taking a prenatal vitamin? That's another question that I got. So it's different for everybody, but if you are having that conversation with your care provider, your midwife, your OBGYN, you're telling them, hey, we want to actively start trying to get pregnant, they might recommend to you to start taking a prenatal vitamin before you're even pregnant while you're actively trying. So if there's a chance that you could get pregnant, go ahead and start taking those prenatal vitamins, but of course have that discussion with your care provider. They have your most up-to-date blood work, information on your health. They'll know exactly what you need and point you in the right direction as to what kind of prenatal vitamin you should be taking. Okay, so the next question that I got is, can I still work out while I'm pregnant? And the answer is yeah, of course, get it cleared with your care provider. I know I'm saying that a lot lately, but I'm not a medical professional. My goal is to help you guys communicate better with your doctors, ask the questions that you need to be asking, and getting the correct information. So if you had been working out prior to getting pregnant, chances are you can still be working out. Of course, you have to modify things, maybe not work your core so much, but that is a conversation you can have with your doctor. There are pregnancy fitness instructors out there, and you can also look up one in your area to see, if they can modify your workout so that you can still stay fit. Because, it is important to stay fit and stay active while you're pregnant, because labor is labor. It's like running a marathon. So you do want to train your body and have your body in a healthy condition to prepare yourself for labor. All right, question number 18. Are water births safe, and how does the baby breathe? Now I laugh at this question, but there are people out there who genuinely do not know. So are water births safe? Yes, they are safe, provided that you've been cleared by your doctor, because there are instances that it might not be safe. And of course, your doctor has all of your ultrasounds and know how baby is positioned, so they can tell you if it's safe or not. Again, your midwife as well too. But again, at a birth center or a home birth, chances are you will be giving birth in water because it is more comfortable. It is a more soothing environment, helps your muscles to relax, your body to open up, and baby to come out. Going to the next part of that question is, how does baby breathe? Now, until baby's face touches the air and they feel the change in temperature, they're not gonna gasp for air. They are getting all of their oxygen and blood supply from their umbilical cord from you, the mom. So all of that blood flow that's flowing through their umbilical cord, that's what's giving their air, their oxygen. So you don't have to worry about if you're pushing and baby's in the water, they haven't started to breathe yet. So they're still getting all of their oxygen that they need from the umbilical cord. Next question. Can I have a glass of wine while breastfeeding? Yes. Now, let me preface this information. So yes, alcohol is still dangerous for babies, for newborns, for children, anyone under the age of 21. But if you're having one glass of wine while you're breastfeeding, chances are, so if you think about it, your mouth is not directly connected to your breast. So whatever goes in your mouth is not going directly into the baby. It's first going to get digested through you, filtered through your body system, and then put into breast milk and then into baby. So if you're having a very minute amount of alcohol, not a lot of that is going to end up in your breast milk. Your breast milk carries around the same amount of alcohol as your blood. So if you can still walk, talk, drive safely, you're well under the legal limit, you're only having one glass of wine or one beer, chances are not a lot is going to end up in your milk supply. And as time goes on. If you had your glass of wine, say 3 hours ago, your body has already filtered that out. You're already, you know, back to normal. That all that alcohol is, chances are, is already gone. So your milk is going to be safe. There's no reason to pump and dump. You know, I've seen, you know, some pictures posted on the internet, which are very nice pictures of breastfeeding moms while they're holding a glass of wine, and people get really upset. But you forget that she's having her first glass of wine. That wine has not reached her system yet. So that milk that she's currently feeding the baby does not have any alcohol in it. And by the time the baby is ready to feed again, there won't be any alcohol in the milk. So it is a very interesting topic to discuss and to learn about. I will link that information down below. There is a doctor called Dr. Jack Newman. He is, you know, extremely educated on breastfeeding and, you know, the art of, you know, if you want to have alcohol while breastfeeding as well. He has written numerous articles about that, so I will link all of that in the description down below. All right, so this is the very last question. What books should I read to prepare for pregnancy and labor? I will link all of those in the description down below, but my favorites are The Birth Partner by Penny Simkin and Childbirth, Pregnancy, and the Newborn, again by Penny Simkin. Those are my 2 favorite books. I think everybody should read them when they find out that they're pregnant. I will link them in the description down below. Well guys, I hope you enjoyed this video. Let me know in the comments down below. If you are new here, don't forget to like and subscribe. Just like and subscribe anyway if you just like this video. I really appreciate it. It helps to grow my channel. Let me know your thoughts again in the comments. Follow me on Instagram, and I will see you guys next time. Bye!